On today's podcast.
And it just brings in so much calm. I originally started using this with patients about 7 years ago for migraines, realized that it had a profound impact on anxiety, started using it for that, and then realized for behavioral dysfunction and disorders in children and like pandas cases even, whenever their brain is just so inflamed and they have a hard time controlling behavior. That's one of those misconceptions in functional medicine that we oftentimes are almost creating dependencies on what our own protocols are and what we're extending to our patients. And we should not be creating the same kind of allopathic model to where we aren't just optimizing the cells. We need to make sure that we're encouraging every single cell in the body to get healthier and to be less dependent on anything out there.
If you're a healthcare provider tired of just treating symptoms and ready to dig deeper into the root causes of health issues, the Vibrant Wellness Podcast is for you. With insider tips, expert interviews, and the latest in biotech research, this podcast will take your patient care to the next level.
Hello and welcome to the Vibrant Wellness Podcast. Once again, I'm your co-host, Dr. Emmy Brown, here with my brilliant co-host, Melissa Gentile. Today, we're joined by a trailblazer in the world of holistic health, Dr. Leila Doolittle, a doctor of chiropractic with a specialty in functional medicine and integrative neurology. Dr. Leila's story is a testament to the power of resilience and the pursuit of holistic health. After dealing with the fallout from a traumatic brain injury, she found the allopathic medical system had little to offer beyond medications. Eventually, she found healing and inspiration for a new career path using a more holistic approach to brain health. As the CEO and founder of Resonance Wellness, Dr. Leila has created a sanctuary for healing and discovery. Her philosophy centers on the belief that every aspect of our lives, from what we eat to how we think, contributes to our overall well-being. With a background rich in functional medicine, neurology, and a passion for natural healing, Dr. Leila is here to share her insights on how to harness your body's innate healing power. So please welcome Dr. Leila Doolittle. Thank you so much for being here, Dr. Leila.
Yes, thank you. It's an honor to be here with you.
Dr. Leila, I am so excited to have you on the podcast today. I think we're going to dive into some really amazing topics that are kind of very unique in the functional medicine space. So I just want to jump right into kind of your personal story and kind of you as a provider. And just from interviewing so many different providers on the show, many providers in this space have kind of a lifelong journey from conventional to functional medicine. But I know you have a really unique experience that has helped kind of pave your path. Can you expand on a moment somewhere within your struggles between mold and brain injury and post-concussion syndrome that really led you to transition from a more conventional approach to functional neurology? And how has that personal story really shaped your approach?
Yes, I'm so blessed and grateful for my health journey because it has been an inspiration into me having these specific specialties that have helped so many. And it was a combination of like toxic black mold as one of the biotoxin illnesses that I had to deal with, and then stacked with the functional neurology therapies that I had to chase to help heal a brain injury. That's really what just led me down my own path of kind of discovering what is the form of functional medicine, functional neurology, integrative therapies that can really support rehabilitation and optimizing overall health. So when I was 13, for example, that's when I was exposed to toxic black mold. Of course, the traditional allopathic world, their only solutions were they wanted to do a tonsillectomy and take out the tonsils because they were swollen. And then they prescribed antibiotics and multiple other types of therapies that just wiped out my microbiome. And then because of that, my immune system started to become imbalanced. And that is really one of my big passions now in functional medicine is how do we help continue restoring that microbiome and the immune system balance? And how can we support the system in protecting it and providing a resilience against biotoxins? And this may be mold or candida or parasites or any of those bad bacteria or viruses that can be dormant. But in my own health journey, toxic by mold has really led into one of my main specialties that I focused on throughout the years. And then when I was 16, that was my first concussion. And I say first because it was definitely a very severe one, and it led me into the world of traumatic brain injury, rehabilitation, and such. But I've actually had 5 concussions throughout the past 15 years, and I'm a very active person. One of the concussions was a snowboarding accident, one was a rock climbing accident, the other one, surfboard came down once I hit the waves, and the surfboard came down on top of my head, and then another car accident. So anyway, it was just a long journey of throughout the years, just continuously creating a neuroplastic optimization through therapies, through exercises, through stimulation of really just how we rewire the neuroplasticity. And I'll go into that in a little bit more detail. But there are so many ways that we have opportunities to continuously invest in brain health. And we each should be doing this to kind of create that anti-aging aspect and really reversal of the aging, creating the longevity in the brain, regardless of if we had a concussion or not. There are so many other factors that influence and impact brain health, neurological health in general. And so that has been a wonderful world of discovery throughout the past decade of really coming up with solutions to provide for traumatic brain injuries or just brain optimization in general.
And Dr. Leila, can you talk us through that first car accident, if you don't mind? What was that like for you? And it seems like from what I read about your history, that's what led you to functional medicine. Is that correct?
Yes, it is. And it was when I was 16 years old, and it was a severe car accident where someone was driving way too fast in the rainy road and in the curves of Arkansas. Of course, it's easy to lose control. So she came into my lane. I spun out of control and hit a bridge head on, going about 55 miles an hour. My head actually impacted with the steering wheel, and I had fracturing of the orbital bones, both above and below the orbit of the eye. And it was such a severe injury that it actually created hemorrhaging, bleeding on the brain, on the frontal lobe and the parietal lobe. And so through that, I actually lost consciousness, and I was in a coma for 8 hours. And my conscious studies now, I'm very passionate about understanding what is consciousness and how can we really understand like consciousness, subconsciousness, super consciousness, etc. And it's because of that time where my consciousness was elsewhere outside of my body. And by the time that I woke up, I actually did have amnesia and didn't recognize my family. I remember the experience of not knowing what happened, not understanding who I was, what was going on, who these individuals were that were over there crying in the corner of the hospital room. And just the only thing that I recognized were these emergency room personnel that were just going all hands on deck to help save me. And so that was my big inspiration into going into emergency medicine. And that's what I thought I wanted to provide, those kinds of like beautiful moments where I could say to a patient, I've got you. It's okay. You're going to be okay. And they have nothing else to hold on to except for those words and that one hope that you can provide. And so my journey for the next 4 years throughout pre-medical studies, and then I became an EMT, started working in the ER. And of course, I realized the disillusion of that very quickly and how we're providing solutions which have to happen in that moment, but also how do we provide the long-term care and the true rehabilitation to where when we say to a patient that is terrified, we've got you. It's not just in that one moment of saving their life, but how are we creating lifelong like optimization of every single moment from then on, not just in that one moment of the emergency happening, but how can we actually provide long-term solutions so that we have that health span of beautiful optimization of every single moment, every single day. So I got back out of the emergency medicine field and quickly went towards functional medicine because it was my own health journey that I still was dealing with the repercussions of some of the biotoxin illness from my childhood and also the traumatic brain injury, because we know that's where the blood-brain barrier can easily open after traumatic brain injury, and then biotoxins can cross and neural inflammation ensues. So I kept chasing my own health, and that was my journey into functional medicine and functional neurology.
And there's a lot there as far as you were inspired by your car accident to go into emergency medicine. And you touched on it a tiny bit, Dr. Leila, but being an EMT, working in the emergency room, working on ambulances, I'm sure, primarily.
Yeah.
Was there a moment in time where you thought, okay, this is critical in the moment, obviously, but maybe they're lost to follow up because you implied that we need to look after these patients after the emergency.
Yes.
So was there a moment or maybe a collection of moments wherein you thought, I want to do more with this?
Yes. Yeah. I had started to shadow so many different types of practitioners, different doctors of various specialties throughout my pre-medical training. And I started working at University of Arkansas Medical School and as an intern in the ERs. And so I was able to shadow so many different practitioners. And that's where I was asking the questions about like why they were prescribing certain medications and how do we follow up to get them back off the medications that we're providing these quick solutions for that are really not long-term solutions that this person should be left on. And so that was where, because I wasn't able to wrap my head around like just turning off physiology with the medications and the prescriptions, and I just did not resonate with the way that Big Pharma was showing up throughout all of these protocols. That was one of my reasons for really turning into that post-care and how we provide true solutions through the functional medicine aspects.
And what was your experience like as a patient post?
Yeah.
Like,
Well, I knew that I would never take a single medication. I grew up as in a very natural, holistic-minded household. So we always taken supplements since very young. I was completely unvaccinated as a child, which I'm very blessed to have very few heavy metals due to that and such. And so I'm so grateful for the way that I was able to have a very nurturing type of lifestyle. So by the time that I was going to these like various practitioners, neurologists that were providing the types of solutions where they wanted to put me on medications for my migraine headaches, and I said no to the pain medications, or I told them that I was having a hard time reading in my textbooks for pre-med, and it's because my eyes were oscillating due to the concussion. Post-concussion syndrome can create movements in your eyes to where it's very hard to focus on the words on a page. They only provided me with like Adderall. They tried to put me on ADD medications, and I was like, I'm literally can't see on the page. It's not that I have a hard time focusing, and I refused to take those. And the lights were very difficult for me to be in because post-traumatic brain injuries, they oftentimes affect the pupils of the eyes. So then I had to oftentimes wear like colored lenses and sunglasses and bright lights. And they tried to provide me with various medications for this. And I refused all of their therapies because I didn't want to put any, exogenous chemicals and toxins into my body. And so I kept on chasing until I found a functional neurologist. And this was about 4 years post-concussion. And he was actually a chiropractor, functional neurologist. And I went to him originally just for my back. I was in dance, like professional dance throughout college. And I had injured my back doing some flying splits one time. And so I found him for my spine. And thankfully, he knew so many procedures and techniques in functional neurology to start rehabilitating my brain. And that was my big inspiration into go to chiropractic school for one, and then functional neurology to get the extra certifications and diplomats for that. Because then I could provide my own patients with the therapies that I had been chasing all of that time. I just didn't know where to find it.
Sure.
Dr. Leila, you speak to this in such a positive tone and positive light. Like you just radiate kind of positivity. But just from hearing about all your health struggles and your personal experience, was that a really frustrating time for you when you knew kind of in the back of your head, like, I'm very used to supplements and natural medicine. I know I don't want to take these medications, but you didn't really know your next step yet before you found the chiropractor? Like, was that a really hectic kind of time for you? Or did you know, like, I know there's something else, I just haven't
Yeah,
found it yet?
I knew there was something else, and I have a mindset I always have since I was young of just researching. I read hundreds of books while I was a child, so we didn't grow up with the TV or watching movies or anything. We were encouraged to just read. And so I had that like research-oriented type of mind where I was constantly going into the white papers and researching the entire time for myself. And I did end up getting my nutritionist certification like my freshman year of undergrad, just so that I could come up with more protocols for myself, just studying into the foundations of supplements and such. And then I started finding supplement companies and representatives to just really glean information from. And so I was self-diagnosing and putting myself on so many different types of supplements for the brain healing aspects that I really mitigated most of my symptoms through that very functional approach before I actually found the functional neurologist to help me. And also, I've always had the mindset of every lesson in life is a beautiful opportunity. Every time that we've ever had a lack of health, it just helps us appreciate health so much more. And then we can chase down the perfect and optimal health, the perfect life that we want to live. And so I never had fear or concern or worry or anything. I just embraced it as an exciting opportunity to research and come up with more ideas and to just put more information into my brain. And when I was 16, I knew already that I was going to be an amazing practitioner someday. And so it was all just gleaning information into my big library of resources that I was going to provide to my patients one day. So I enjoyed it. I was appreciative of it for sure.
Yeah, I think that's really inspiring to patients and practitioners themselves.
Yeah.
Yes, you ooze gratitude and, like you said, Melissa, positivity. It's very inspiring to see. And it reminds me of, I don't know if you've heard of the Clifton Strength Finder, but it's basically a kind of personality test, an aptitude test, if you will. And my number one strength is positivity. And I wouldn't be surprised if one of your top strengths is positivity and relating to people, intellection. So yeah, really, I that resonates with me. And it's just such a joy to see. But let's jump into what functional neurology is. I think a lot of listeners are new to this concept. And as we've already inferred, functional neurology is going to be extremely beneficial for something like a TBI and post-concussion syndrome. But you have on your website, it's also helpful for some surprising conditions. At least I wasn't aware. So schizophrenia, for example, bipolar disorder, vertigo. That makes sense with some of the maybe maneuvers conventionally used for vertigo. Also ADHD, multiple sclerosis, and more. So you can really use functional neurology in so many ways, so many indications. Can you tell us simply what is functional neurology? And can you maybe tell us a little bit about what were the first types of exercises or tools that your functional neurologist used with you when you came to him with the post-concussion syndrome?
Great questions. Well, let's start with defining what neuroplasticity is, because that will help us understand what is functional neurology and integrative neurology too. And neuroplasticity is where we have neurons that communicate across synapses. And those synapses are where there are receptor sites for these communication signals through neurotransmitters, through hormones, through proteins, through signals. And we have to be able to have healthy communication between the neurons for them to do their job, for them to be able to perform the functions. And that's any type of function, whether that's thinking, whether that's mood control, whether that's behavior or personality and how you're showing up in the world, or if that's just how you're perceiving your environment around you. And that's where, that vertigo or vestibular issues could be come into play. There are so many different concepts that are dependent on just the foundation of that communication between those neurons. And so neuroplasticity is where, through various signals or activation, we can create and encourage new neuroplastic connections, so neural synapses to grow and connect. And we can actually encourage those neurons to form new neuronal pools and new neural connections wherever we're utilizing those pathways over and over repetitively. So functional neurology is the theory behind exercises and stimulation to the various neuronal pools, lobes of the brain, cranial nerves, the peripheral nerves that send signals up through the central nervous system to the brain. And we're able to route in like the activation to encourage that and to encourage those to grow. It's kind of like a workout for the brain. And we just have these specific areas of function mapped, and then we use those areas and use the function itself to encourage more of that opportunity for the communication. And so with functional neurology, there are many different types and many different variations of it. Of course, there are so many amazing devices out there. Some of them are just very, very unique for specific areas in the brain or activation signals. And some of them are more like a kind of transcranial type of stimulation and therapies. Maybe some light therapy for the brain would be something like that. And we can use either specific types of activation, whether it's like a cranial nerve, like a vagus nerve activation, or we can use like a broader approach for encouraging that neuroplasticity. So specifically with my functional neurologist that I saw, his name was Dr. Chance Norman in Conway, Arkansas. And that was about 13 years ago. So whenever he started working on me, he was using a very traditional type of functional neurology approach where he did therapies for pursuit function, which activates the parietal lobe. For example, this is where your eyes follow a specific target, back and forth, up and down, maybe in and out, and these different types of movements of the eyes activate cranial nerve 3, 4, 6, and the parietal lobe for that type of movement. And to use some saccades, which is eye movements back and forth to specific targets. That's the frontal lobe that sends those signals to the eyes to be able to move specifically in those patterns. And then the cerebellum is what helps catch your eyes on the specific target. And so it's starting to route different types of lobes of the brain with just very simple eye movements. And then we stack that with different therapies of some balance therapies. We did a few like just standing on perturbated surfaces, which is a type of balance theme and such. And then we do some walking and finger to nose type techniques, such as the parietal lobe has the map of the brain. So for example, it gets complex whenever you add in and stack all these different little exercises, but you can go back to very simple types of therapies. And even these are some therapies that we all can use at home to optimize our brains day in and day out. And so it's not just specific disorders or dysfunctions where someone would want to use functional neurology. It can also be just to help optimize our minds and our brains for meetings, for conversations, for the way that we're showing up in our daily lives and our careers. And so that is very important that we're able to have tools that we can use. I can share more on that as well.
Such a good workout. I mean, such a good point, rather, because it is a mental workout. I mean, see, I need to go do this. Everybody does, because even if you feel good, we talk so much about prevention and we talk about exercise, physical exercise, but mental exercise, I don't think we, even as a wellness community, talk about very much still. And preventing cognitive decline, being really sharp, sleep is a huge conversation. I feel like it's on my mind more and more because I'm seeing more podcasts on it. But as far as that mental exercise and the tools that we can do beyond reading or whatever it might be, coordination and dance, you said you're a dancer, so that's a wonderful mental workout. But these little things you can do at home and learn from your functional neurologist, I think that's fascinating. So, and you don't need a device. Like you mentioned devices, Dr. Leila, which I'm sure are used primarily in office, right? And so, but at home, are you prescribing exercises for patients at home? Are they using any kind of devices at home also?
Yeah, so I do. Most of my practice is actually virtual at this point.
Okay.
I have patients from around the world, and I give recommendations for specific kits based on a functional neurology exam, which that can be completed online. I have them arrange their Zoom call in a specific way where I can then put them through the various testing strategies and analyze where their specific exercises can be recommended to them based on their own brain findings. And then it's easy kits that They come in the mail. Mostly Amazon is a quick and easy way for me to ship that kit to them. And then they have all of those different tools and techniques. I actually have some patients that are around the world and they don't have access to these specific kits. They aren't able to order them to them. And they can use something as simple as just a pen and start doing balance on their own couch cushions and such. And then I can have them, go through various exercises that require absolutely nothing for them to just stimulate the brain. It just is about the intention and stacking that with specific function. And then the cranial nerves are constantly working. We just are able to bring in various cranial nerve activations at specific times to encourage that neuroplastic growth. You mentioned sleep. That is definitely something that is very unique to you. I've been doing so much more with longevity and specifically longevity of the brain. And sleep is crucial. And specifically, I love measuring the biometrics that you can measure through, like, say, an R ring or Whoop bands or some of these other devices that are out there. And I've been able to have an HRV, or heart rate variability, that goes up to above 250, which is, if you know about HRV, that is pretty rare. And I can say there are specific types of functional neurology therapies that I've been working on, these protocols, and I'm starting to get to that point that I can effectively get HRVs on average above 150 when we have these specific therapies that we're stacking in that maybe our patients will use right before they go to bed.
Actually, you really piqued my interest there about the HRV, and mostly selfishly because I wear an Oura ring and I very diligently look at my HRV every single day. Mine is pretty high. It is close to about over 200 most days. I actually met with an Oura ring rep recently, and she said that, the highest that she had seen was 250. So that's like really impressive that you're getting HRV above 250. But what do you think the biggest factors that play into that are? I know you mentioned that you were kind of like curating these different at-home exercises specifically for HRV. Can you give us and the listeners maybe like top 3 things that you're seeing?
Yes. Yeah, there are protocols specifically with functional neurology, and then also bringing in like the parasympathetic function and really that polyvagal theory, and bringing in the calm for wherever someone is and however that we need to bring calm into their minds. And I'll add to some of these types of techniques that each person can use too. But then also the functional medicine, we'll have to go into discussing about that and like what things someone can take from a nutritional approach. And so with that functional neurology, like for example, I would have them do these specific neurological exercises, and that's unique to every individual. And that might be something as simple as these pursuits like we were talking about. Horizontal pursuits are very calming to the parasympathetic system because of the location in the brainstem, that those cranial nerves 3 and 6, where they insert into the brainstem. So the way that you're moving your eyes can be very calming, as well as vagus nerve stimulation. We know this is very parasympathetic as well. And we would want to also use the vestibular cochlear nerve. This is a really interesting like neural hack that I don't think many people realize is one of the fastest ways to help support and boost the parasympathetics. And I usually use an insufflation tube, and it's just very simple, like puffing air into the ears with this type of insufflation tube that attaches to an otoscope. And then this insufflation helps to move that tympanic membrane, and that stimulates that nerve to send those signals into that pontine region in the brainstem, and it just brings in so much calm. I originally started using this with patients about 7 years ago for migraines, realized that it had a profound impact on anxiety, started using it for that, and then realized for behavioral dysfunction and disorders in children, and like pandas cases even, whenever their brain is just so inflamed and they have a hard time controlling behavior, that helps with that calming. The list goes on. And then just recently I've been seeing how incredible it is for that like longevity approach of really stacking it into a very calming and peaceful type of stimulation. And this is for rest, digest, and regeneration, that's all the parasympathetic functions. So very unique opportunities there. And then with the very calming approaches, like the Epsom salt and essential oil type bath right before bed, and then stack that with some very important forms of magnesium. We have so many different forms of magnesium, so you want to make sure you're getting the right forms. That will really help you with sleep. And the list goes on and on. We could go on for quite a while about the sleep protocols, but those are some of the stacks that I've used to get the HRV up above 250.
Okay, there's one other therapy I did want to ask about you as well. I know we kind of touched on a little bit what you're doing with patients like virtually and at home. But one thing I read about on your website that really interested me is quantum biofeedback. I've heard the term biofeedback before, but can you walk us through what is that and how do you use it, or if you even have any specific cases that stand out to you that you've used it in?
Yes, absolutely. I love this quantum biofeedback device. It's QUEX. D is the name of the specific device. And this quantum biofeedback is unique in how it captures information, records the information, but it's many different levels and forms of the frequency that's recorded. So biofeedback in general, it's measuring the frequencies that your own system is more reactive to or is most trying to like send signals to of reactivity. So then what happens is the biofeedback, it will create reports based on that. And the quantum biofeedback that we're using, we are able to map meridians and see exactly how kind of the traditional Chinese medicine model will be affected. We can map like meridians at the teeth and the dental aspect. We actually have biotoxins that are all measured on there. So that's a great way for us to get a clue into what else we need to do further testing on to get the specific levels of
the toxin that you mentioned just there, do the toxins have a specific frequency? Is that how you're measuring it?
Yes.
Whoa.
Yeah.
Okay. I just want to make sure I'm following this right and making sure I'm understanding. So is this sticking to the person's skin? Like what does the device look like? You know, if I were to do this, what would you be walking?
There are leads that go on each wrist and each ankle. And then there's a lead that comes around the brain and it's just across the forehead. And so it is taking in measurements and it can measure those changes in those biometrics. But it also, this is the unique thing, it can capture information remote as well, which is the quantum aspect. And I'm going to use myself as a case study to answer that because that is so hard for any of us who are in science in general to wrap our heads around. Is like, how can it measure whenever you're not even hooked up to the device? But for example, I was in Switzerland and I had a rib go out of place. And for example, my own history of this rib, whenever it goes out of place, I can hardly breathe. Like whenever my head hit the steering wheel when I was 16 in that car accident that we were referencing earlier, my chest actually hit the bottom of the steering wheel and I fractured like 3 of my rib heads at my sternum level. And so now I still have issues with this. Every 3 or 4 months, it'll just go out of place. I was traveling abroad, and in Switzerland, there are like 6 chiropractors, and you have to take a train to another like city to try to get into them. And they are tough to get scheduled with. They're booked like 2 weeks in advance, at least at a very minimum. So it went out of place. I was hardly able to breathe. My oxygen saturation was down at like 88%. I was struggling and I was in excruciating pain. And I called our biofeedback specialist and I was like, just start running me on the biofeedback. Let's see what we can do. And biofeedback, our specific device, it not only takes in measurements, but it actually does treatments as well. She started running it and within 30 minutes, it just cleared it up. And I was able to go back to like normal breathing. Of course, this is so hard to like even still measure why pain changes that much. And it actually was able to help with shifting it in place to where I was able to have those expansive breaths again. And that's now we think about placebo versus nocebo. So then I'll bring in another case study for myself where I love proving to myself that it was not placebo at all. I had a sinus infection. One of my assistants in the office knew that I was showing up for I had another podcast recording and a full recording and a video, and I could hardly even talk. I was like super nasally. I was just like there's so much runniness everywhere. It was just not going to turn out to be a pretty recording. And she actually called our biofeedback specialist and was like, start running Dr. Doolittle right away. She has to show up for this in 45 minutes and we can't clear it up any other way. I didn't realize that I was getting runs. So this just helps with that placebo versus nocebo effect. It cleared up within like 20 minutes of running. And so it's pretty incredible, those kinds of case studies with the quantum world of biofeedback. But anyway, we went on a little tangent there. Going back to originally, what is biofeedback and how it can support the system? Biofeedback with those frequencies of how we measure specific biotoxins. Every different toxin has a frequency, every environmental toxin, every biotoxin. And what we can do is we can see that mapped and it'll just show up as what level it's mapped at. And that's from a frequency standpoint. But I do still like to have the science and the data from lab testing to compare it to, and also to show that to the patient so that by the time I put them into a robust protocol, then they know why they're clearing it. Like say for mycotoxins, for the mold, I want to understand from the total tox burden test exactly which levels of toxins are in their toxic burden bucket. What I need to clear out is measured from before and after so they can see that big change. With the biofeedback, we'll also see that that frequency has disappeared as far as in the report, pre and post treatments. Then that's cleared up as what their signal is no longer putting that out, what their body is no longer putting that frequency out. But it is important to have that hand-in-hand measurement quantitatively.
Complex for sure.
Yeah.
I definitely need to revisit this when this is all recorded and published because you went over a lot there, but it is intriguing to say the least,
Yes.
Dr. Leila. And I know that this quantum biofeedback fits into my next question, along with how you're using HRV, but how are you using functional neurology maybe in other ways to assess other body systems? So not just our nervous system, but hormones, including cortisol, or how do you use functional neurology for weight loss? I know that's another service that you offer.
Mm-hmm. Yeah, this is where I do a lot of the functional medicine aspect as well. And so I think it would be a bit under functional medicine in how I'm using measurements. And as far as treatments go, I love using supplement approaches for really helping to optimize neurotransmitters, optimizing the way that the hormones are balanced and the communication signals in general from like a metabolomics and microbiome point of view for how the system epigenetically can be optimized with every one of these different signals. So like, for example, whenever we think about hormone regulation, we need to optimize how the glands are functioning. We know the master glands, the pituitary gland and the hypothalamus, these are what creates the stimulating and the releasing hormones that are required for thyroid, for the testes or ovaries, or for the adrenals to function optimally. So that's the foundation that's always going to be linked to the patterns of functional neurology and specifically how these glands in the brain are able to send the proper signals. And then with epigenetics, like the microbiome, we know, for example, there are specific types of probiotics that we can give to really encourage new healthy levels of those neurochemicals for the neurotransmitters. We want to provide the building blocks for the neurotransmitters from a supplement approach so that those pathways that produce dopamine, for example, or GABA can be optimized. We know serotonin, as every neurotransmitter is completely dependent on each other one. Serotonin, 90% is made in the gut. So we have to really have that approach of that functional medicine with the functional neurology to optimize how these neural signals and these communication signals are linked in the system. And we know optimizing hormones, optimizing neurotransmitters, optimizing the communication signals, it's all going to be very, very relevant and dependent on how healthy is that autonomic nervous system. Back to the parasympathetic function, the body can only stay in this healthy neural communication and communication through each different cell if we are in that rest, digest, regenerate, and healthy healing phase. Everything shuts down when we're in sympathetic overdrive. Mm-hmm. And so if the brain has those communication signals and those ruts that it's been sending those signals through over and over, and it's not able to get out of that sympathetic overdrive, then the system is just going to continuously stay in that denatured form of the communication.
I love that you mentioned sympathetic overdrive, because I know we've been talking a lot about sympathetic versus parasympathetic, being in that calm state. So this actually ties into my next question, because I want to talk about nutritional and lifestyle interventions. And I want to ask your opinion, like what are some common misconceptions that the role of nutrition and lifestyle have in neurological health? My brain first goes to like caffeine consumption, especially because you just talked about the sympathetic nervous system. So let me know if I'm wrong on that one, but I want to hear your thoughts there.
Yeah. Yeah, it definitely, there are so many interesting and very unique ways that I think we we can definitely lean towards more health. I think that caffeine is one of those very unique ways that where our system can so easily become dependent on that for energy, and it's a fake energy because it's not the mitochondria actually producing that healthy level of energy and sustainable level, and then the dependence itself now creates the compromise of the adrenals, and the circadian rhythm itself is altered if we miss our caffeine dosage, or the headaches that ensue when someone has caffeine withdrawals. Like, this is what shows us it's kind of like a drug almost. And what happens is the brain becomes very dependent on that. If so many patients come into me and they'll say, I don't have bowel movements unless I have my caffeine in the morning or have that coffee. And that's where now the enteric nervous system is dependent on that for the peristalsis. And so we don't want anything for any product out there, any supplement out there, or any medication out there to be a dependency, because then the system itself is not resilient. It's not sustainable for it to be dependent on that. And caffeine is definitely one of those. But truly, I think that what we also need to factor in is like if someone can find that right balance, if they really enjoy a nice cup of coffee, like a nice little latte every once in a while, and their system can handle that and it's resilient for that big burst of energy, and the way that it sends a lot of signals and stimulation to the nervous system and to the entire every system of the body, well then great. Are they able to have the resilience and not be dependent on it? And does it just bring in peace, excitement, enjoyment, and happiness? And it's kind of like that, there's so much joy in it, in that cup of coffee, that it's worthwhile. That's the payout that we need to do. If we're going to take away something from a patient, how much is that going to affect them? But I do encourage every single one of my practice members not be dependent on anything, including any supplement that I put them on. Every single supplement has the get-in date of how long I recommend for them to take it. There are some, general, very specific types of general support. I think like the way that NutriPros, for example, that's what I use for my own support system. And that's like the multivitamin, multimineral, and multi-amino acid type of approach that's specific for my cells, for what epigenetically I need. And that's my foundation to where I should be able to create anything else from any other products that my system would be able to have for those communication processes to be optimized. I think that's one of those misconceptions that in functional medicine that we oftentimes are almost creating dependencies on what our own protocols are and what we're extending to our patients. And we should not be creating the same kind of allopathic model to where we aren't just optimizing the cells. We need to make sure that we're encouraging every single cell in the body to get healthier and to be less dependent on anything out there.
I like that you brought that up, because it's almost like in some cases you're replacing pharmaceuticals with just nutraceuticals. And like you're still dependent on something that's outside of yourself. But so I like your approach of intention there. I do have another question regarding nutrition and lifestyle. What are kind of your top 3 lifestyle factors that you want to see your patients avoid? Like, is it screen time? Is it sugar? Like, what are your top 3? Like, if you can avoid this, we're on a good path.
Oh yeah, great. Definitely the sugar. I always try to give them alternatives because we know they're going to go out and eat it anyway. Now, how are we able to minimize the type of sugar? And I think with that, we have to go back to also what is bringing the most joy in life. Like if they love chocolate chip cookies, right, have it once per month and you make your own healthy recipe at home to where you can enjoy it. Like same thing with alcohol. Go and enjoy it sometimes. We know that your liver is obviously going to have to deal with it. That it should not be a like 3 or 4 times a week type of thing, because your system is just going to be overwhelmed. So obviously not daily thing either. And that's where some patients find me, and they are overdoing it with that. So I think minimizing and providing solutions for and alternatives for alcohol, like for example, mocktails. There's so many wonderful types of mocktails that can be created where you're actually optimizing neurological function with it. Like rosemary is an amazing fresh herb for stimulating memory, focus, concentration. It really stimulates many great neural pathways in the frontal lobe, executive function, such. And rosemary itself tastes so delicious, especially whenever you pair it with a little bit of pear. And the pear itself can be a really unique type of flavor profile that someone really enjoys that just as much. Like, great, that's an awesome alternative. But I think everything in moderation. What I teach is everything in the right moderation where you're not dependent on it. That's what's the most important. And I actually don't take away anything just cold turkey and forever and for any of my patients. Gluten is a really big conversation topic.
That's what I was
for
going to ask.
many as they come in, because gluten itself has been adulterated so many times over, and the genetic modification aspect of gluten, it's at this point, our system just doesn't recognize it, especially for the Purkinje fibers in the cerebellum. Having that molecular mimicry, it can really create many neurological dysfunctions like cerebellar ataxia as such. But with that, with gluten, I have patients come off of it for a minimum of 6 months and just completely eradicate it from their system, oftentimes using the wheat zoomer as proof to show them why they need to come off of it. And then I give them the option at the end of that 6 months. And I'm like, now look how amazing you feel. Go try it if you want to. 99% of them, they go try it. They realize how horrible they feel. And then they're off of it for the rest of their lives, per their choice. But I also think that it's very important for them to prove to themselves and for them to make that level of commitment, not just because somebody else told them to, but intrinsically because they realize how much better it is for their system. And that's how it is with like sugar, alcohol, caffeine, or anything like that. It needs to be the right moderation and with the healthiest versions, the healthiest forms of it. And then whenever it brings that joy, peace, happiness, and enjoyment, because you're like in the midst of, maybe it's like a social thing and you're able to spend time with others and you're in that peace, well, then your system will receive it better. Your cells won't be as reactive to it. And then your system knows how to also handle and process it and clear it from your system.
You explained that so well, Dr. Leila, and I love you're explaining what I'm always telling practitioners here at Vibrant is teaching our patients how to fish, and doing that elimination and that oral challenge and reintroduction so they can learn from experience, because you're putting the power in their hands. They can't always look to you. Of course, there's check-ins now and then because health is a journey and really not a destination. But if they feel okay with a little bit here and there, great, that they found that out on their own.
Yes.
So
Right.
that's hugely valuable, and it's something they have to experience. Can you tell us what gluten ataxia is and maybe other neurologic signs and symptoms secondary to gluten? Because we talk so much about leaky gut, but I don't think we've talked enough about the neurologic impact that can occur in association with gluten for a lot of people.
Absolutely. Well, leaky gut, leaky brain go hand in hand together. And we know it's the same pattern of the gatekeepers are dysfunctioning, then that gluten can go right across, easily inflaming the brain. It's the immune system itself that creates the reactivity, because we know that gliadin, the protein in gluten, one of the proteins in gluten, it has a molecular sequence that looks so similar to the Purkinje fibers and also to the thyroid and to the GI tract and the lining of the gut. So this is why the cascades happen from gluten sensitivities and the inflammatory reactions. But particularly in the cerebellum, we have the Purkinje fibers, and the Purkinje fibers are a specific type of neuron that are like the brake system for the cerebellum. And this is what's creating the calming effect for the brain. And in the cerebellum itself, we know the cerebellum is the part of the brain that helps to deal with coordination of movements, coordination of perception of the biomechanical types of where the joints are in space, and just the perception of how someone is walking around and moving. And it's also the coordination of the immune system. So it helps with the T helper cells and T regulatory cells to really balance that Th1, Th2 part of the immune system. And so with whenever that gets inflamed and then the system isn't able to have that brake system that kind of helps with calming these portions and really creating the balance, that's whenever we can deal with more significant autoimmunities. And we know, particularly when gluten is in the system and it's already been flagged, and we have the antibody and antigen type of response now, then your immune system is going around looking for more gluten to flag it, tag it, get rid of it, clear it from the system. And the problem is that sometimes it can see other materials like the thyroid, like the leaky fat that gets created, like the lining, and the Purkinje fibers in the brain, to where now we have that immunological reaction against the brain. So cerebellar ataxia is like a type of tremor, or we see intention tremors that can ensue from it when that cerebellum has been inflamed because of the immunological reaction against that tissue. And so when someone goes off of gluten and that immune system calms down, the inflammation calms down, and it's no longer attacking those Purkinje fibers in the cerebellum, that's when we can see incredible and unique things really clear up with someone. So it's the movement. It may clear up some tremors that are cerebellar ataxia, for example, or the intention tremors, or it can clear up some of those signals of like that misperception. So even some vestibular system issues, the balance and such, and then the immune system itself, that balance comes back. And also just coordination of thoughts in general. The cerebellum has such a unique opportunity for overall nervous system regulation, and the way that you have that empowerment through very clear thoughts and processing can be optimized just by clearing down some of that inflammation from gluten issues.
That's amazing. And I'm sure, well, I'm wondering, Dr. Leila, have you talked to conventional neurologists about diet and going gluten-free? I mean, because, well, and I think they recognize that this is possible, and there's gluten ataxia that affects many patients. And this leads me to my next question. Have you had these conversations with conventional neurologists? And if so, how do you coordinate care? How do you maintain and foster those relationships for best outcomes for your patients? And how do you recommend other practitioners really reach out to other practitioners, more conventional practitioners, to foster those relationships?
Yes. Oh, this is a great question. And I'm so blessed to have an incredible referral network that I've built throughout the years. And it's because I love having conversations based in the science, based in the research. Like I was saying earlier, it's just ever since I was little, as soon as I learned how to go into the white papers and go into the research, really study into NCBI and PubMed, that's whenever I was able to really gain access to so many tools and resources. And that's what neurologists, of course, the way that their analytical minds work, that's the reason why they're specialists in these fields, but also many other allopathic practitioners, that's what they know, that's what they love, and that's what they respect, is the research and the science. And so if you go in with no ego and very carefully and cautiously trying to just like support a conversation, then there isn't going to be the barrier against dysfunctional medicine aspect and approach. And so I've had many, many conversations with neurologists, and I do have in my own referral network those that are more functional medicine minded or more open to our approaches. And then some other ones where I've gently worked with them throughout the years and not stepped on their toes in their own protocols. And I've just worked with their patients enough to where they've seen the evidence of how we're clearing so many systems and just clearing so many different diagnoses that they trust the process. And so it is very important that we're cautious in the beginning of the conversation, but really as long as you can just score a moment to like sit down with them, I think in person is best with any of these practitioners, just handing them some of the white papers and then coming in with a pure heart where you're not getting like aggressive with it, then they're all open. I don't think I've had really any bad conversations with an allopathic practitioner throughout the past like 6 years of me being in practice. And I have like 20 plus allopathic specialists of different specialties that are on my list right here in Dallas area. But then also I've been reaching out because I have so many different virtual patients from their other states. And we can get on Zoom calls or schedule something with their lead nurses and have these conversations behind the scenes. And they're pretty open as long as we come to them with the science.
So good to hear. And it's really just, like you said, taking the ego out of it and focusing on what's best for the patient with the research in mind. And I'm sure you show them through many successful case studies that this approach does work. So, and that's
Yes.
again, such a positive outlook on coordination of care. I think a lot of more functional minded, holistic practitioners can be intimidated by that process. So, and I love that tip about meeting in person if you can, right? And it's really just, let's collaborate. It's collaborating for the sake of the patient. It's not, like I'm right or you're right, or, let's argue, but let's figure out what's the best for the patient. So I think that's super helpful.
And Dr. Leila, kind of going off of that, what emerging trends in functional medicine or integrative neurology are you most excited about? And, what are you kind of hoping to see change in the next 5 years? I mean, it sounds pretty positive since you've had such great experiences with these other practitioners, but kind of want to expand on that a little bit more.
Yeah. Well, definitely in the longevity world, I think this is the new frontier that we're all leaning into. And specifically with this functional neurology approach, we have such a great opportunity to really support how the healing of the brain and really the optimization of the brain function. But how can we create and reverse brain aging? And with longevity, there are so many approaches in the functional medicine aspects that is impacting and affecting the brain, but definitely with the longevity for optimization of neurological activity and neurological function, and then the longevity of how we're actually turning off the epigenetic aspects of the expression of the cells. And we can use functional neurology approaches for that within the epigenetic expression of these neurons as well. And we have so many different measurements for neural health and really just how we can measure for, like, say, Alzheimer's prevention, or for really understanding the epigenetics behind like dementia and neurodegeneration or Parkinson's, and like neural zoomers and the neural health tests. I really appreciated being able to see how before and after certain longevity protocols that we'll have practice members following, those are truly reversing those signs. And what we are seeing on those biomarkers, we're able to see those huge alterations and changes, and then craft and curate the plan specifically around epigenetic markers, like, for example, the ApoE marker, and just how every single different variation we would use a different approach. And that very specific, tailored longevity type medicine, I think, is a huge frontier for all of us, whether we're in functional neurology or just functional medicine or any other type of field. It's important that we're really leaning into this and appreciating this opportunity for these conversations.
Yeah, I love the conversation of longevity in this space as a whole. I feel like it's just such a big topic right now, and I'm loving it, and all the science and research that's coming out, and that it's such a big focus for everyone right now. So yeah, but Dr. Leila, thank you so much for joining us today and just sharing your expertise on functional neurology and all the different like home exercises that you can do with your patients. It was really such an interesting conversation. I definitely have a list of things I'm going to be researching after the podcast today. But before we wrap up, I do want to ask a few fun rapid fire questions just so our listeners can get to know you a little bit better. So the first one I have for you is, what is your ideal morning routine?
I love this. I do get up and I start with 10 minutes workout of some sort, whether that's a quick leg workout or an ab workout, core workout. I am always going to start with moving my body. I also drink at least 30 ounces of water first thing in the morning to flush the kidneys. I do at about 3 days per week in the morning some lemon water that I drink with a straw so I don't take off the enamel of my teeth.
Ooh, smart.
And that just helps to create some of that healthy clearing of the kidneys as well. Sometimes I'll use a lime instead, and that's a bit of the alkalinity aspect. And I always journal and meditate practically every single morning. There are certain mornings that may look just more like planning my day because it's a quick day that I get things going and moving. And that's okay because I'm just staying in that mindfulness, the awareness, and the intention, and setting the intention for my day from a very, very healthy state of gratitude, of that mindfulness, of appreciating that I am able to maintain that really, really healthy energy for my team to be able to be inspired by, for every practice member to feel. The healing starts with that, starts with the energy. And every time that I'm making moves and decisions in my practice, it comes from that place of that mindfulness, that intention, that awareness, and that healthy, positive energy.
That's truly leadership right there. I want to frame it in that way. And it's so many things. It's self-care, it's discipline, but framing it that way for showing up for your team is very inspiring. And you have to take care of yourself first before you can take care of others, and patients too.
Absolutely.
Right?
Yes.
Okay, next one. And then we only have 3, so don't worry. If you could have any superpower, what would it be?
Oh, I love this. It would be medical intuition. And I say
Ooh.
medical intuition because I love that idea of being able to have anyone coming to me to see me and I already understand exactly what is truly going on. Most of it I already have from just the insight of functional neurology, functional medicine. But there is an energy oftentimes that has affected the cell's health that then leads to diagnosis. So it's not root cause, it's beyond root cause. It's beyond just the like toxins and the biotoxins. It's an effect of the resilience. And with that, we know that, yes, we can reference traumas, but trauma itself in the brain is just, there's a biochemistry of trauma, and that's dysfunctioning because of something else deeper down. There's an energy that's altered, and it's how we each show up in our daily lives, in our own health journeys. And either we just lean in and appreciate and have gratitude for every single piece of information that our bodies are telling us through symptoms, or we have a difficulty with ever processing and ever getting over it, or ever letting go of our stories and releasing whatever has gone wrong. And that's what I would love to really speak to with every single practice member, because that's the true healing. And so that's the medical intuition. It's being able to connect on that significantly deeper level to truly help someone to feel and to heal in that space, that truest, deepest space. And then I know that we would have absolute optimal health throughout any time of their journey, because everything else, the cells are able to optimize and function from there.
I love that. I was going to guess when Emmy asked that question, I'm like, I bet you she's going to say read people's minds because you're into brain health. So kind of on the same wavelength there.
I feel like you're already doing it to an extent. Like you said, your intuition is there. I sense it. So trust it.
I appreciate that.
So our last question for you is, who is one of your role models and why?
Wow. That's a really good question. And I would say, this is going to sound crazy, but it's my higher self. Like I appreciate so many others. However, I am always being sure to just appreciate and glean information from each individual that I respect and appreciate throughout the eons, throughout the decades, throughout their training, throughout their teachings, etc. But it's my higher self, because my higher self is what I'm constantly trying to live up to, and I'm constantly trying to lean into more, and I'm always discovering and aligning with that. And it is truly my highest version of how I express, how I'm going through each day, every decision that I'm ever making, every thought that I'm thinking and inspiring others with. It's always trying to come back to that alignment with the highest version of my soul and who I am. And so it's vague, but my highest self.
It's profound.
Really, yeah. And where can our listeners find you if they want to learn more about your background, your practice, you as a practitioner? What is your website, social media channels?
All of it's Dr. Leila Doolittle on all social media channels. My website, it's just my spelling of my name is the confusing part. So Dr. Leila Doolittle. And yeah, I would love to connect with anyone and just share conversation or inspiration.
Absolutely. And we'll make sure that we put your website in the show notes too. That way patients don't struggle with the spelling and they can find you.
That sounds good. I'm looking forward to it.
Well, thank you so much, Dr. Leila, again, for being on the podcast today. This is such an insightful conversation. I just want to thank you and all of our listeners for being here and wishing everyone vibrant health and wellness.
Thank you so much. It was such an honor.
Thank you so much for being here today. Don't forget to leave us a review and subscribe so we can continue to pay it forward together. And remember, the key to longevity is knowledge. Keep learning, growing, and tuning in to the Vibrant Wellness podcast to discover the latest insights and strategies for optimal health. Join us again next week. Just a reminder, this podcast is for educational and informational purposes and is not a substitute for professional medical advice, diagnosis, or treatment. The views expressed by guest and host are their own and do not necessarily reflect the official policy of Vibrant Wellness. As always, consult your healthcare provider before applying any recommendations that you heard here today.